Important that you understand the anatomy of a frame so that the technical terms that you read about in the catalog, you'll understand what that corresponds to. So, to begin, this is a frame front, and the portion that holds the lens into the frame is called the eye wire. So this whole piece around the lens is the eye wire. The piece that bridges the two eye wires together is called the bridge. The piece that wraps around the front of the frame towards the back is called the end piece, and that attaches to the temple. At the end of the temple that wraps around the back of your ear is the earpiece. Then on the inside of the frame you have the hinge that attaches the end piece to the temple, and you have the nose pads, usually silicone, that are attached to a nose pad box, and that nose pad box is attached to the nose pad arm, which is the actual part that gets adjusted to match up with the individual's nose. And the nose pad arm in turn is attached again to the back of the eye wire. So this is the anatomy of an eyeglass frame, and there are very few variations on that theme. The other aspect has to do with lenses. We have a front curve of a lens and a rear curve, a backside curve of the lens. And the angle of the curvature between the front and the back, as that differentiates, steeper in the front, less steep in the back, or any number of variations, determines the prescription or the power of that lens. Ultimately, this lens blank is going to be cut down to the proper shape to fit inside the eye wire. So the front of a lens is called the plus side or the convex side. The back of the lens is called the minus side or the concave side. So those are the terms that you should become familiar with, so that reading about how the tools function in the catalog will become a lot clearer to you. Thank you.